Hello and welcome to my channel. In the last lecture, I told you about the Wilm's tumor and its important features in the morphology, that is Gaussian microscopy. In this lecture, I will tell you how to draw the diagram of Wilm's tumor. So before you listen to this lecture, I would suggest you to go to the lecture on Wilm's tumor and understand the morphology of Wilm's tumor. So coming to this diagram, in the Wilm's tumor, in the microscopy, I have told you that it is triphasic in histology. There are three phases which are seen. The first is the blastemal phase, second is the epithelial, and third is the stromal. In the blastemal phase, we see the round blue cells which are having very scanty cytoplasm, and they are arranged in the form of sheets and cords. And the second is the epithelial component. In the epithelial component, there is attempt of formation of tubules and glomeruli. They are known as abortive tubules, abortive glomeruli. When we make the tubules, so we have to make a tubular structure with a lumen in the center. Sometimes a structure like rosette is also seen. So these are called the abortive tubules, and then we make the structure which is similar looking like the glomeruli. So in the glomeruli, we know that there is a Bowman's space which is seen, and then there is a outer epithelium, parietal, and there is a tuft of capillaries which is seen in the normal glomeruli like this. This is a normal glomeruli, and this is a normal glomeruli. So there is a tuft of capillaries, Bowman's space, and the outer epithelium. These are the glomerular structures. So here in Wilm's tumor also, the structure similar to the glomeruli, they are seen, and these are made by the these tumor cells. So these are the tumor cells, and they are forming this space which is similar to the Bowman space, outer epithelium and inner cells. So this looks like a glomeruli, but this is not the glomeruli, so it is known as abortive glomeruli. The third element is the stromal. Stromal cells, they are spindle shaped cells, and they are seen in between this blastemal and epithelial elements. So now let's have a look how this diagram is made. So this, giving all these three elements in mind, we start. So first we make the various tubules, abortive tubules and glomeruli like structures. So tubules, we make this rounded structure with lumen in the center, and these we make the nucleus, which are dark purple in color, and they have got a scanty cytoplasm. Now the glomerular like structure, we have to fill this lumen partially with these cells, so they look like the abortive glomeruli like this. You first make the outer outline of these cells, then you fill the lumen partially with these cells. Next you make the blastemal element. See, the blastemal cells is a round blue cells having scanty cytoplasm, and they are arranged in the form of cords and sheets like this. So you fill this diagram with these cells. This is the blastemal element. You can make more tubules, more glomeruli like structures. Thirdly, we make the stromal component. So this is the stromal component. So here we just make the spindle shaped cells. Then in the spindle shaped cell we make the nucleus. So lastly we fill this background with this pink color. You can use the pink used in pencil and make the background of pink color, which will highlight this the stroma of the tumor. Now lastly the labeling. So we label the blastemal cells, then the abortive tubules, these glomeruli which are abortive glomeruli, and lastly the stromal cells. So this is how we make the diagram of Wilm's tumor. I hope it is useful, and it is also very easy to understand if you know how to draw this blastemal element, epithelial element and stromal element. Any questions, they are most welcome in the comment section. If you have any query, then you can ask. I hope this video is useful to you. Thank you very much.